Hello, friends. It's Facebook time once again, and today we are going to talk of a very, very relevant topic of today, that is COVID, and whether fertility treatment is actually valid, or is it justifiable, or is it ethical to do fertility treatment, namely IUI, IVF, or even minor treatments during these times, these pandemic times, these disastrous COVID times. Well, to begin with, what exactly is COVID? I mean, or what is corona, as people would know it? Well, it is a virus from the SARS family. That is, it causes SARS, that is severe acute respiratory symptoms. And it is a CoV2 virus. And it actually means, CO actually means corona. Corona means the rays of the sun. So the virus looks like a ball, a sphere, and it has divergent arms like the rays of the sun which comes out, which gives it the name corona. A lot of things have been told about this virus. Was it man-made? Was it China-made? Was it a mutation from an animal variant? Well, I will not go into all those complexities, but what is true is that it has infected us, it has affected us, and it has affected us in a very, very big way. Around a year back, around the same time was a time when we actually did the Janta lockdown, and we were all anticipating the corona pandemic. We were in a big cusp, in a big tangle, a big dilemma what to do. What is this virus? It is so unpredictable. That is why it is still called the novel coronavirus, whether we still yet are discovering as to the various nuances of this new so-called new virus or novel virus. Well, to begin with, as far as fertility treatments were concerned during this time, last year, we pulled it to a very painful and a grinding halt. The main reason was lack of knowledge about the virus. We all know virus can cause a lot of congenital problems in the baby. And this lack of knowledge was the main reason, the main concern for the patients that we actually pulled the plug on the treatment protocols. We weren't very sure about the vertical transmission, whether the virus will be transmitted from the mother to the child. Of course, till the end of last year, we had no vaccine, and hence we couldn't actually immunize our patients or ourselves against this virus. So we weren't very sure whether we should treat. And if we treat, how will it affect the patient? How will it affect the baby? With all these things, the prudent judgment was to, by all the professional bodies, was to put a halt to assisted reproduction. We weren't sure whether the pregnancy would worsen the disease or the disease would actually affect pregnancy. Within this dilemma, the world actually stopped all fertility treatments, except in cases of emergencies. And emergency in fertility is basically when it comes to onco-fertility or treatment of oncology patients or fertility preservation in cases of oncology patients who are due to get the chemo or radiotherapy. What followed after a month and a half of waiting was a slow but protracted and deliberate recovery of our services. This started mainly because we now realized what the roots of infection were. Of course, it still stands that it is generally a respiratory virus and it can only spread through droplets. So covering your nose, the mouth, and your eyes, of course, because that is again an exposed area, could actually prevent the disease being transmitted from one person to the other. Slowly but surely, we came to understand the pathophysiology of the infection, how it infects the person, what are the receptors onto which the virus would bind, where are these receptors present, and slowly but surely, we started preventing the roots of spread and actually monitor the course of disease. Plus, a lot of new antiviral drugs which are specific for these virus were developed or were propagated. Plus, we also came to know how the disease would proceed in an adult. Luckily, the youngsters are not affected. What is the exact time to start assisted ventilation? looking after which system of the body would help the individual fight this virus better. A lot of these knowledges from different part of the world started percolating, and we were more and more confident of holding a good battle against the virus. A point to be noted, however, is no world professional body ever pulled a halt or gave an advisory against natural conception. What it Where it helped us is that people who were infected with the virus and conceived naturally showed no problems in their offsprings. That gave us a little more confidence. And the professional bodies slowly started relaxing the guidelines, which are very stringent to begin with. And the patients and the concerned doctors could now see the light at the end of the tunnel. Slowly, the fertility services started resuming, and people started realizing that if certain precautions were taken, we could give safe and effective fertility treatment to our patients. But the game changer came at the end of the last year. I mean, was in the form of vaccines. A lot of vaccines. I mean, I'll not go into the details of vaccine. India has its herself produced a couple of them, and really doing well. In fact, today I was very proud to be an Indian because India has administered the maximum number of vaccines to its citizens, even more than the US, which comes next. Of course, the vaccines also were had its share of skepticism. There was a lot of initial skepticism whether the vaccine produced in our own sweet country could actually be effective. But over the period of time, this skepticism has been replaced by a lot of resolve, a more determined fight by the medical community, who, in fact, were the first people to actually take the vaccine. And is the vaccine safe? Well, initially, the guidelines which came out in the early part of January were to defer vaccination or defer conception till vaccination was given, and vice versa. The peri-inoculation period was considered not very safe, or possibly not very sure whether it would have any adverse effect on the child which is growing inside. But inadvertent pregnancies in those people in the peri-inoculated time frame showed that the offspring still now has not shown any disastrous or any uh, untoward side effects. So we assume that vaccination will not have a hazardous effect on the offspring per se. Now, this is about the technicalities of the COVID infection and fertility treatment. So, what as a patient should you do when you have to get yourself treated? Well, it's very simple. Make sure that you are knocking the doors of a center which is braced itself to fight this pandemic. Make sure that the center that you're knocking is actually following the protocols of the government. Make sure that the center has personnel inoculated against the virus. That is, 100% of the population or serving you is vaccinated by either of the two vaccines that is available in our country. Plus, make sure that the center is doing your tests on you before your procedure, if at all, and during the procedure, depending on the stage of the cycle that you are in. Because a lot of people would have different sort of SOPs in their center. Also, most of us are so very particular about cleanliness, especially after COVID. Make sure there is a sanitizer kept in all the consulting rooms. Make sure that people are cleaning the ultrasound rooms, the ultrasound probes, the ultrasound beds. Make sure the rooms are being intermittently sterilized with the help of UV light. All these things will actually prevent the spread of the virus. Why is it important? Well, you are very well aware that the first wave has been tackled very brilliantly by our country. But now we are standing at the cusp of the second wave. So are we really ready to let our guard down? Not at all. Never. You still have to be protecting yourself, using a face mask, using sanitizers, using eye shields. Everything is going to help you prevent the virus entering yourself. Protocols are still very, very applicable even till date. Screening of all patients in terms of temperature, SpO2 is mandatory. But not only patients, all the staff. Even today, before I enter, my security guard will not allow me to enter my center unless my SpO2 is normal and my temperature is absolutely normal. Personal protection is absolutely necessary, even while operating, even while consulting. And judicious treatment. We know that we are in a very tough time, so we shouldn't try to make unnecessary investigations on our patient or unnecessary procedures on our patient. Let's be a little judicious when it comes to picking up these cases. And of course, the final thing which will really help us to be out of the woods is possibly universal vaccination. So, till that happens, of course, India is steadily progressing towards universal vaccination against this COVID 19. But till then, we are still not out of the woods. We, doctors, and our patients, both of us, should form a team, and it's absolutely teamwork which really matters. And together, if we decide that we need to treat infertility, we can do it even in COVID times, especially if we take our due precautions. It is 100% safe if due precautions are taken. With that, and let me encourage you, people who haven't been blessed with parenthood, to knock our doors. And despite COVID times, we can go through this treatment of infertility in a very, very safe manner. Thank you. I think we would be having some questions. So, the first question is here. Miss Preeti is the one who's asking us the question as to is fertility treatment safe during COVID times? Well, initially, Preeti, as I've already said in my talk, it was deemed not to be safe. But today, I think with due precautions, as I've enlisted in terms of, let's say, personal protection, screening, universal vaccination, or at least vaccination of the healthcare professionals, uh, regular sterilization, using sanitizers. With all these minimal steps, we can make fertility treatments absolutely safe even in COVID times. I hope that answers your question, Preeti. Uh, Guru has asked us a question. Does vaccine have any side effects? Okay, Guru, I'll address this question of yours in two terms. Well, let's talk about the general side effects. Well, after vaccination, you do anticipate a bit of fever because that is normal in all the vaccines. Some amount of injection site pain might be there. A very, very, very minor percentage of the people do have certain respiratory symptoms and certain sudden collapse. But these are very, very small. In fact, we did about 500 odd vaccination, and touch wood, we didn't have any of these side effects. Okay, that is a generalized side effects that we are talking about. But what about fertility side effects? Till now, I'm very proud to say that none have been reported till date. And the beauty is, most of our reproductive tissues, be it the seminal fluid, be it testes, be it vagina, be it the secretions from the vagina, be it the uterus, be it endometrium, be it the ovary, be it the cumulus, none of them would have the receptors for the virus to actually attach. There are a few studies which say otherwise, but most of the studies say that all the reproductive tissues are devoid of the receptors where these virus or these viri could actually attach themselves. So luckily, we are a little safer from the virus in the field of reproductive medicine. And similarly, the vaccine also wouldn't have much of side effects on the fertility treatment or the fertility outcome per se. Lovely has asked a very a pertinent question. What precautions should one take during these times? Well, lovely. It is protecting yourself at the utmost, also of utmost importance. Social distancing, of course, is still mandatory, because even if I have taken the vaccine, I still have the potential to actually infect, because if the virus is residing in my throat or the nasal mucosa. So social distancing does matter. With social distancing comes another barrier called the face mask and the eye shield, use of sanitizers. These minimal things are what will help you in reducing the course of, I mean, the chance of infection, especially during these times. Of course, on a medical term, we need to sterilize, fumigate, use UV lights whenever in between and in between procedures and in between patients. All these minor things will definitely help us prevent the spread of this disease. Raziuddin has asked a question: where do you see the pandemic and the fertility treatment progressing? Well, we have been through this intertwined journey of the pandemic and the fertility treatments for about a year now. And I think the fertility treatment is definitely having the upper hand as of date. Initially, of course, we are subdued by the enormity of the pandemic per se, and of course the lack of knowledge that we had at that time. But today we are more confident, more resolute in our approach in treating infertility. We will not let the pandemic affect us. We will take precautions, and we will treat our patients with more diligence and more empathy. So, as time goes by, I think despite the pandemic, we will be continuing with fertility treatments. I hope that answers you, Razi. Uh, should one take vaccine if planning for pregnancy with IVF? Well, if IVF is planned, the guidelines in January, as I've said, say that either the pregnancy should be deferred or the vaccine should be deferred till either one of them is settled. But people who have been vaccinated and accidentally conceived have uh, not shown any side effects per se. So the news is very encouraging that the vaccine is very, very safe. Well, the jury is still out. The final verdict isn't yet back in. And let's wait for the professional bodies who actually analyze a lot of cases before they give the verdict. But what I would say on my small, humble level is that vaccine is a must, vaccine is safe, and everyone who is getting vaccinated should be aware of what they're doing, and whatever minimal risk is there should accept it before taking the vaccine, or during pregnancy or during IVF. So it is an informed decision that one has to take with all these three things, that is vaccine, pregnancy, IVF. Raziuddin has come up with another question: what precautions are taken at IVF Center for fertility treatment? Well, most of the IVF centers do have a SOP for the same. Most professional bodies have come out with SOPs as to how to do the cases during the COVID times. Of course, the first is insisting on the personal protection, insisting on staggered OPD, insisting on social distancing, using barriers between the doctor and the patient. That is as far as OPD consultation is concerned. The ultrasound room, regular cleaning, use of UV light between the patients will reduce the risk of transmission. When it comes to operation, between cases, we have to fumigate the operation theater. During IVF, also to reduce the spread, we have to use precautions. We have to clean the tables, we have to clean the microscopes, we have to clean ultrasound probes, everything. It is doing these things repeatedly again and again and again. And of course, most important thing is to use personal protection equipment, that is PPE. I think with these small steps, we can definitely prevent the transmission of disease during treatment or during IVF per se. I don't think there are any more questions, and well, the video will be live, will be there on Facebook. And if at all there are any more questions, please feel free to drop in a line. Feel free to ask anything, and it will be a pleasure to educate, to spread the knowledge, and join us in the fight against infertility, despite being infected with COVID or the world being infected with COVID. Thanks a lot. Thanks for your time and have a great weekend. Thank you.